Good day, I'm Theodore Henry, and this is your JIS News for Friday, October 24, 2025. The tropical storm warning and the hurricane watch continue for Jamaica, while tropical storm Melissa remains nearly stationary to the southeast over the Caribbean Sea. Melissa is projected to become a hurricane by Saturday and a major hurricane, Category 3 or higher, by Sunday. The center of the storm is expected to begin drifting westward on Saturday and continue through Monday, bringing it just south of Jamaica early next week. 8 to 14 inches of rainfall is forecast for eastern parishes through the weekend, causing widespread flooding and landslides. This would gradually spread westward across the country next week. As the tropical storm moves closer to the island, expect strong gusty winds reaching tropical storm force to initially affect eastern parishes later today and continuing into the weekend across the island. Hurricane force winds are also possible from as early as Saturday. While marine areas will see quick deterioration today, small craft operators including fishers from the Keys and Banks are advised to remain in safe harbor until all warning messages have been lifted and wind and sea conditions have returned to normal. All public hospitals across the island have entered emergency mode as the health system prepares for the impact of Tropical Storm Melissa. Minister of Health and Wellness Dr. Christopher Tufton reports that while hospitals will remain open, outpatient and elective surgeries will be suspended for the time being to focus on emergencies.
Visitations will be limited, and family members are asked to pick up their relatives who have been admitted for non-critical reasons, and the respective hospitals will reach out to those family members. We have to reserve bed space just in case we need them for emergencies.
Dr. Tufton says 116 priority facilities have been identified, comprising 25 hospitals and 91 Type 3 to 5 health centers. 702 personnel are on standby across parishes for emergency response activation. The minister reveals that 75% of the facilities have functional backup generators with fuel reserves capable of sustaining power for approximately 72 hours post-disaster, and they have sufficient medical gas and supplies to last for the same period.
Strategic stockpiles of medications and medical consumables have been verified and are maintained at a minimum 72-hour level.
87% of the priority facilities are also reporting fully functional transportation for emergency response and patient support. Dr. Tufton says there are approximately 5,000 beds, 20 operating theater units, and 19 emergency rooms available across the public system, with plans for the rapid redeployment of mobile response teams if required.
And there's one functioning field hospital which is currently being deployed at the Maypen Hospital.
And the Health Ministry's 24-hour Emergency Operations Center is now fully activated to keep in touch with all the collaborative agencies and to man the public health sector's response. Meanwhile, residents are being reminded to ensure they have an adequate supply of prescribed medication on hand. Health Promotion and Education Officer at the Westmoreland Health Department, Gerald Miller, is urging persons with chronic illnesses such as diabetes, hypertension, and asthma to refill prescriptions and secure medications before the storm's arrival. Pregnant women who are within 1 month of their due date are encouraged to relocate nearer to medical facilities as a precautionary measure ahead of the storm. The health promotion officer is also generally cautioning residents to avoid walking through puddles or floodwaters after the storm, as this could expose them to leptospirosis, a disease spread through contact with water contaminated by animal urine. And Mr. Miller is reminding residents that mental health care is equally important during the storm, encouraging persons to try and engage in activities that can help relax their minds. The National Water Commission, NWC, says it has enacted measures to ensure that water is supplied before, during, and after the passage of Tropical Storm Melissa. Acting President Kevin Carr says all existing water restrictions have been lifted to allow customers to store water. He says all hurricane response team members have been briefed and placed on high alert.
Managers have met with their parish disaster committees to continue local actions. Every equipment, including water trucks and backhoes, has been prepared or placed on standby in regions where contractors' support may be required. Private providers of standby generators have also been engaged in case additional capacity is required.
In St. Thomas, pipelines located in landslide-prone areas and across rivers have been temporarily removed to prevent them from being washed away during heavy rainfall.
Open trenches at work sites are currently being reinstated ahead of the bad weather and will be revisited for inspection and repair immediately after the passing. Storage levels are being filled and secured to support post-storm recovery. Teams are on standby to close off intakes such as yalas to prevent silting and blockages.
He adds that private water truckers have been engaged to ensure hospitals and other essential facilities have access to water after the storm. And working groups have been established with key partners like the Jamaica Public Service Company, National Works Agency, and the municipal corporations to ensure access and service continuity after the passage of the storm. Minister of Local Government and Community Development Desmond McKenzie says the National Solid Waste Management Authority, NSWMA, had intensified garbage collection efforts to address backlogs affecting several communities island-wide. Minister McKenzie, who spoke via Zoom during a special press briefing on Wednesday, outlined preparations being undertaken by the authority.
The Solid Waste Authority over the last week and a half have been working extensively, especially over the last couple of days. We have been doing extra hours, even in some communities, working 24 hours a day around the clock. And as I speak, there's a special operation that is being undertaken island-wide, and there are some specific areas that have been identified for attention.
The minister noted that consistent heavy rainfall had made waste collection more difficult in some areas.
The organization is working, but I must admit that the volume of garbage that we have, and with the consistent rainfalls that we are having, and the fact that most of our landfills, the roads are not fully paved, make the exercise a little bit tedious. But over the last couple of days, we have seen some increased activities.
Minister McKenzie reiterated that a targeted waste removal operation was underway in select areas across the island to address accumulated garbage. The country's oil refinery Petrojam is assuring that all measures have been put in place to best manage the events of the coming days. Acting General Manager Colin Barnett says Petrojam has over 2 weeks' supply of fuel in stock and 10 days' supply of liquefied petroleum gas, LPG, in storage. As Jamaica's primary storage facility for strategic reserves, valued at over $200 million or 162 billion Jamaican dollars, he says the strength of its energy supply resiliency remains intact. Mr. Barnett adds that Petrojam's teams have stepped up efforts to ensure timely fuel delivery from their Kingston and Montego Bay loading racks to establish supplies through the vast island-wide logistics chain. He says Petrojam is ready to activate further contingency measures should the need arise. And as the various state entities work to get the country ready for dealing with whatever tropical storm Melissa brings, Minister with responsibility for works, Robert Morgan, is assuring that the government has a strong disaster management template in place.
The government really did significant work before, during, and after burial to ensure that the country was able to recover stronger.
Mr. Morgan says government, primarily through the National Works Agency, has executed some significant projects over the last few years which are assisting in the management of disasters.
For example, in the St. Thomas area, the South Coast Highway Improvement Project has resulted in a significant assistance to the population there as it relates to drainage. Where there were not drains before, there is significant infrastructure that has been put in to assist with drainage. Also, on the other side of the island, which is in St. James, the perimeter road is also a significant work has been done with drainage.
The minister also points out that roads completed under the Spark program were designed with improved drainage to ensure that less damage is done to communities. For the current system, several contractors across the island have been engaged to stockpile critical materials that will be essential in the aftermath of the storm. And finally, Jamaica's two main telecommunications providers, Flow and Digicel, have activated their emergency response centers in preparation for the storm. Telecommunications Minister Darrell Vaz, in a special briefing yesterday, shared that Flow's generators had been refueled and serviced, and field teams had been mobilized.
Flow Jamaica has fully activated its crisis management system with support from local and regional teams. Power resilience has been strengthened with over 61% of mobile sites now having backed up power and 143 new generators installed island-wide. Company's Emergency Operations Center is active and the public can reach the center for emergencies at 876-929-9834. I'll repeat that, 876-929-9834 and 876-929-9837.
The minister also reported that Digicel had formed a dedicated disaster response core team to ensure continuous operations during the storm.
All network sites, towers, and facilities have been structurally inspected and generators confirmed to be up and running condition. Essential spare parts are secured locally and overseas, and mobile cell sites are ready for rapid deployment to restore service.
And that's it for JIS News Today. I'm Theodore Henry. Thanks for watching.